We've debunked the myth of the opioid epidemic a few times, and now we can do it again thanks to an excellent article in Skeptic magazine by Raymond Barglow. As he points out, drug overdose is now the leading cause of death in Americans under the age of 50 and is responsible for a lower average life expectancy. Basically, everything government has done to prevent this problem has just made it worse, as usual. Barglow points out 3 big mistakes the drug warriors are making. And the first is the ever-popular mistaking of correlation for causation. As we covered in the past, even the CDC claims that drug prescriptions are what's driving the problem, but their own data shows that just isn't true. In fact, since 2012, the death rate from opioid overdose has skyrocketed while prescription rates have actually fallen. Barglow points out what listeners of this podcast already know. The culprit is actually strong opioids such as fentanyl and carfentanil, which are 50 to 5,000 times as potent as heroin, and are easily available on the black market. They're easier to produce than heroin because you just make them in a lab. You don't even need a grow operation, and it's a lot easier than cooking meth. But even back when there was a correlation, that still doesn't mean that the one causes the other. Barglow points out, quote, "The correlation between prescription and overuse of opioids is no more causative than any number of treatment-illness relationships. Surgery, for example, typically makes a patient more susceptible to infection, a fact that supports more attention to sanitizing operating environments, but doesn't justify a reduction in the number of surgeries. Similarly, taking birth control pills slightly raises a woman's chances of contracting cervical or breast cancer, but this happens sufficiently rarely that it provides little reason to forego this method of contraception. The solution that continues to find favor among legislators, enactment of prescription reduction rules that are insensitive to the complexity of medical pain treatment issues, has proven to be not only largely ineffectual, but also medically unjustified. The consequence of too strict prescription requirements is the abandonment of many patients to their suffering. Deprived by their physicians of the pain relief afforded by opioids, they are motivated to look for a solution elsewhere." The second is the fact that they just don't understand the psychology of addiction, which, as Barglow points out, has actually been studied down to the molecular level. Quote, "Research on the behavioral and biological dynamics of addiction shows that supply restriction may actually strengthen addictive habits rather than suppress them. Paradoxically, when the supply of an addictive substance becomes risky, intermittent, or limited in some other way because of a police crackdown, for example, the consequence is sometimes an increase in the craving that holds the addiction in place. This occurs not only in the case of substance misuse, but in other human risk-taking activities also. Compulsive gambling, for example, is similar to drug use in that uncertainty of outcome is apt to reinforce an addictive habit." And the third mistake is overlooking the social psychology. Barglow points out how the disease model of addiction can be just as misleading as the just say no approach. Quote, "Many of those who are addicted can succeed in diminishing the harmful consequences of their drug use and sometimes in halting that use altogether. In the 1960s, about 20% of the U.S. soldiers in Vietnam became addicted to heroin, but when they returned home, more than 95% stopped using the drug. Further, these veterans were able to stay clean, provided they did not re-enlist and return to the war. Their high rate of recovery is in keeping with subsequent research indicating that addiction can be remedied by a change in environment. In previous studies carried out in the 1960s and 1970s, solitary rats have been placed in small cages and given access to water containing addictive substances such as morphine or cocaine. The animals soon prioritized consumption of this water and drank enough of it to kill themselves. In the rat park experiment, however, rats inhabited a shared environment consisting of a roomy cage providing many amenities, nooks and crannies that the animals could explore, balls and other toys to play with, and places to hide. In this socialized situation, they overwhelmingly preferred ordinary to drug-laced water. Many subsequent studies have confirmed the hypothesis that rodents living collectively under low-stress conditions do not become substance addicted. So what does Barglow say we should do? Quote, "Portugal, for example, decriminalized illicit drug use in 2001 and then funded addiction treatment programs and a public information campaign. Education about drug use became part of the standard Portuguese high school curriculum. These policies have helped reduce the country's per capita drug mortality rate, which today is about 50 times lower than that of the U.S. And maybe add to that, stop torturing pain patients. Maybe one of these years someone in government will actually listen to what the experts are saying.